Currently, the body of research available focuses primarily on cognitive impairments in aging adults diagnosed with Alzheimer's disease. However, more recent research is looking at the influence of emotion-based learning in these patients. Specifically, the use of humor and emotional disclosure have been found to create physical, emotional, and interpersonal benefits. Before we look at the research, I'm going to use some real-world examples to illustrate the natural progression of aging, first from a physical decline perspective and then from a cognitive perspective. My grandparents are the volunteers and have consented to this to the best of their ability. This is also a bit of fun for me because my grandparents are very special and they love to use humor. So, first I will introduce my grandparents. My grandmother's name is Gurdave, and she is now 88 years old and diagnosed with a severe form of Alzheimer's disease. She is being cared for in an assisted living facility and is full care. She suffered a few strokes in the past and is degenerating rapidly. Physically, in addition to the Alzheimer's and delirium, she is extremely frail and unable to do activities of daily living unsupported. As well, she is unable to walk due to extreme muscle atrophy and overall weakness. Her memory is quite impaired and often mistakes her children as her siblings who passed away many years ago. She experiences episodes of delirium, often envisioning things occurring to her from her past, such as a snake biting her. She often responds to the statement, "I love you," and humorous interactions when visitors initiate them seem to help her snap back to her old self. My grandfather's name is Gabel, and he is a 90-year-old left-side stroke victim. He lives with my parents and I, and is independent of his activities of daily living, though he does experience left-sided weakness. He loves to do simple exercises throughout the day, just at home, as he has difficulty leaving the house even just to get into the car. He struggles when it comes to emotional regulation and can become very angry when irritated. For the most part, he becomes sad and emotional regarding his declining physical status, often feeling hopelessness. He copes by spending time with his son and grandson primarily, and laughing with them. He has a mild form of dementia, often forgetting what day it is, especially the time after the sun goes down. Occasionally, he will mistake me for another family member and ask me questions about how my work is going and if I have to drive and spend time in traffic between Surrey and Vancouver, where our other family members live. In the DSM-5, dementia is now called a major neurocognitive disorder. According to Higgs and Gilliard, it is a significant deficit interfering with independence in everyday activities. In the different domains, it means deficits in areas such as learning and memory, complex attention, language, executive function, social cognition, and perceptual motor skills. Dementia is also referred to as a mild neurocognitive disorder and often is described as being in decline instead of deficits for the various symptoms. In a study conducted by Evans, Roberts, and Turnbull in 2011, they wanted to conduct an experiment that demonstrated preserved complex emotion-based learning capacity considering substantial memory impairments in Alzheimer's disease. They argue strongly for the person-centered approach in dementia patients, and that while they may be missing certain cognitive aspects, they are able to remember basic emotions, even love. As well, they hypothesize that these patients are able to form new and lasting relationships based off of emotions. The researchers wanted to abolish the stigma that we lose our personality and identity with a neurodegenerative disorder diagnosis. Their focus is on emotional expressions and perceptions, but in the past, they state that emotion has been found to enhance episodic memory in Alzheimer's disease patients, something that made the researchers very excited. The researchers are also very excited as the neuropsychology of emotion and its subsequent literature is changing and developing at such a fast pace. In this study by Evans, Roberts, and Turnbull, the study followed a participant called Mr. A 71-year-old man with no history of neurological problems or severe mental illness. His memory problems declined significantly during the course of 8 years and was unable to remember his own name, date of birth, birthplace, mother's maiden name, or anything like that. He wasn't orientated to place or time, he could no longer write or spell correctly, and couldn't leave the house alone. He also couldn't recall the assessment visits or the tasks he completed. He was assessed using the Wechsler Memory Scale 3. He couldn't complete tests such as the California card sorting test and couldn't understand the rules of tests such as the Stroop test. When his performance was analyzed qualitatively, it was found that his dismal performance was due to impairment in psychomotor functioning. He was normal, though, at verbal fluency tasks. The researchers found that Mr. A was able to acquire and retain new emotional knowledge about interpersonal relationships. He couldn't remember the people he became friends with, but consistently got along very well with them every time they met. In the study, there were 10 control participants between the ages of 65 and 79. They completed the Iowa gambling task in this study and were told to select cards in any order from 4 decks labeled A, B, C, and D. They would frequently lose when selecting from decks A and C versus B and D. This task was administered on 3 occasions, spaced 1 week apart. The central finding of the study was that Mr. A's performance over the 3 weeks was found to be much better than chance. He consistently showed normal levels of emotion-based learning performance, and in the information gained through interviewing Mr. A's wife, it was clear that he couldn't recall recent events or people, but in this study, it demonstrated that he could gain new emotional knowledge in interpersonal relationships. However, a limitation of the study is the sample size and needs more people to be able to understand the incidence rate and to be conducted longitudinally. The study was exciting for researchers because it's breaking ways to understand the person-centered approach for individuals diagnosed with Alzheimer's disease. Looking back at our real-world examples, the study reminded me of my visits with my grandmother. There were instances where she would be consumed by her delirium, but when we would tell her that we love her, she would be able to follow our lead in conversations. After we told her we loved her, she would lovingly talk about wanting to be there for our weddings. Though this is anecdotal evidence, it seems to have some similarities with the study with Mr. A.
I love you.
We really love you.
I love you.
As we learn more about the brain, we're learning that these emotion-based systems may be mediated by emotion-related brain areas in the subcortex, like the amygdala. This is what I found exciting about this topic. It's so new, and we're learning how important the emotion centers in the brain are in episodic memory. According to Halford Litchfield, due to the fact that the brain is so complicated, it's important for us to establish a culture of dementia care where language, environment, positive person work, and human values are able to come together in order to facilitate opportunities for personal growth to flourish. Especially considering dementia care in a daycare setting, these person-led approaches are often really challenged by time constraints, limited resources, and the need for staff who are well-trained and committed to a person-centered approach. Due to the fact that dementia care is so individualized, it's so important to follow a holistic approach, where we work on our communication with those who have dementia and focus on being creative, flexible, compassionate, and responsive with these populations. The second study I looked at by Stevens in 2011 looked at humor and its potential to benefit individuals diagnosed with dementia in the realms of memory, learning, sociability, communication, and self-esteem. Researchers implemented a course that taught people with mild neurodegenerative disorder how to perform stand-up comedy and improvisation over the course of 8 two-hour weekly workshops. They conducted a literature review to study the benefits of laughter and found that laughter is beneficial to the immune system, heart disease and cardiac rehabilitation, reduction of pain and discomfort, and stress. Importantly, it involved humor in relationships to develop interpersonal skills and positive relationships. It was a qualitative study with semi-structured interviews. An example of some of the questions would be, please tell me about your experience with stand-up comedy workshops, or tell me about your performance. It included people with dementia, principal carers, a respite coordinator, and a stand-up comedy facilitator. The study included people with mild neurodegenerative disease, 15 of them to be exact, 8 women and 6 men between 78 and 86. They found that confidence increased and skill increasingly was enthusiastic each time they went up. In the interview data, the participants couldn't recall the workshops or performances specifically. Before the program, however, the participants would usually just go home and go to sleep. But with patient H, for example, he kept saying funny, funny when he got home, something that quite surprised his principal carer. Over the course of the study, participants began to positively anticipate going to respite. As well, they went from 30-second performances to some lasting almost 10 minutes. The participants also remembered some parts of the routines, roles, and even some lines. This exercise built on skills in improvisation and confidence in performing. However, there were some limitations in the study. The researchers didn't include patients' perceptions of the program in the moment because they didn't interview them at that time. As well, there's quite a small number of participants. Furthermore, there was limited triangulation of the data because the researcher only attended 2 of the workshops. All in all, the researchers derived 6 hypotheses for further research in this area. They found a positive effect on memory, learning, sociability, communication, and potentially self-esteem for those with mild neurocognitive disorder. As well, mild dementia didn't impair the ability to laugh or create humor. Furthermore, they found that improvisation was good for mild forms of dementia because it doesn't rely on memory. Lastly, there was an ultimately therapeutic effect of laughter on their overall health and well-being. With my topic, my research concluded with 2 qualitative studies. This is a limitation in my firm ability to understand emotional processes in relation to memory and coping for individuals with dementia in a more firm sense. As well, it's difficult to present these findings in a concrete way, especially due to the subjectivity of the information gathered. However, I found these studies extremely useful in understanding anecdotal evidence and how valuable the hypotheses formed and conclusions made can be. For example, relating emotions to the amygdala in the brain helps us gain insight into brain degeneration and emotional dysregulation in dementia patients. There is great potential for developing more quantitative methods for studying dementia and the brain, especially in aging populations, as I've seen through my research. I really like that through qualitative research methods, you can gain a very human perspective on interpersonal relationships. Furthermore, I found a body of research discussing the protective factors against dementia progression. Those include physical activity, use of humor and laughing, being surrounded by empathetic and supportive caregivers, and keeping up with medications. Exercise is definitely a protective factor, something that my grandpa regularly engages in, sometimes making me wonder if he just misses his wife a lot. My grandpa, having a mild neurodegenerative disorder, really benefits from exercise and keeping active, and it's something that improves his mood and helps him feel more fresh during the day. In his case, with regard to physical changes, it's very hard to him to cope with what he's dealing with. He used to grease my dad's truck, now he greases his knees. He used to cut the grass, now he cuts his beard and hair. He used to garden and landscape, but now he just plants his butt. And he used to go for walks and runs outside, but now he struggles to walk at a normal pace. But he still tries to keep active and maintain health. As for his mental and emotional changes, he's very forgetful with the date and time, experiences daily emotional highs and lows, and has anger problems occasionally. But what helps with these changes is the use of humor and laughing and being surrounded by empathetic and supporting caregivers, especially with his diagnosis.
I lack exercise. I lack activity. I lack exercise. I love my family.